So I'm Kiruba Nagaratnam. I'm a stroke physician and also the regional stroke lead for BOM.
And I'm Eleanor Wicks. I'm a consultant cardiologist at OUH, and I'm also co-founding a tech solution trying to optimise primary and secondary prevention in cardiovascular disease.
So I was taking part in one of the panels which I really enjoyed, sharing our experience of implementing AI in stroke pathways.
I'd love to hear more about that. I think it's phenomenal what you've achieved in so much short time. Could you take us through the process and how you've managed to get to where you've gotten to?
I think the major reason for the success in implementing AI in stroke is the network collaborative approach. So I can say three things that played a key role. Number one, we've identified a clear need. We needed to increase the number of patients who receive mechanical thrombectomy. And the second reason is that there was a clear direction from the policy perspective from NHS England. So the imaging pathway has included where AI can be used to improve detection of stroke. And the third reason is how we were able to deploy it through stroke networks. And they were amazing delivery vehicles. So when we approached the networks, we were able to do that across a large geographical area and scale up the technology at pace.
So there are certainly key elements that I'm very well aware of, but actually it's the practicalities of overcoming the barriers and the inertia that often exists in the NHS to really drive forward change. And it's phenomenal because the entirety of your pathway and understanding each of the stakeholders that you need to engage with, I think is for me fascinating.
Absolutely, Eleanor. Stakeholder engagement is key to this. And we were able to engage with every stakeholder, particularly the clinicians, very early on, and very clearly demonstrated the benefits. So how we approached it is that we've had a champion site. So we were fortunate enough to be one of them at the Royal Berkshire Hospital. So we were able to share our learning more widely because clinicians are more likely to have the open conversation with other clinicians to identify the benefits. And then we supported the vendor to apply for NHS Health and Care Award because that was another key enabler because of the funding that came through this award helped us to scale up the technology across multiple networks, as well as we were able to evaluate the technology as well. So that means that we have more evidence to support the use of AI in stroke. The Health Innovation Network actually undertook the independent evaluation. It worked, and we now have evidence to show that when AI is being used to make decisions for treating patients with stroke, we can do that much faster. So we can reduce up to 50 minutes. And also when AI is being used to make decisions, patients are 70% more likely to receive mechanical thrombectomy. This is the result of our largest evaluation, which is undertaken by Health Innovation Network, which includes 80,000 patients, 5 stroke networks and approximately 25 stroke units.
Gosh, certainly in the cardiovascular network, we kind of go minutes means muscle, i.e. the sooner you can treat, the better the prognosis, the better clinical outcomes.
Cannot agree more. Every minute we delay, 2 million neurons die. So that's absolutely key.